So thanks for bearing with me. Welcome, Rigo, Vipra, and Pearson. Thank you for taking time today.
No problem. Thank you.
Yeah. And what I wanted to do, so for everybody listening, what we're doing today is Venice Family and Food Forward have agreed to come in and share a little bit about how their Catalyst program is going. And I have a lot of respect for this, and I thank them profusely, because part of doing this work is sharing what's going on as often and with others outside of your project as you can. And they're really embodying this behavior that's so important to being a catalyst, is doing some work, working on your project, and then coming out and saying, here's what we're doing and here's what we think's happening. And it's a great way to both synthesize things for yourself as you share, and then also to hear feedback from others in the community. So that's what we're doing today. And what I thought maybe we start with is just introduce the team and the project that you're working on, again in a kind of in a compact way, where you're trying to get at the essence of what you're working on, so that a external audience goes, oh, interesting, that's great, tell me more, right? So go ahead, and maybe Rigo, you want to start? Looks like you're rearing to go.
Absolutely. Yes. Thank you, Chris. We are the Venice Family Clinic, but we're comprised of 3 organizations. We have Food Forward, which is a food recovery program, and they're currently providing fresh fruits and vegetables to our food distribution events. We have 2 distribution events a week, and Food Forward are the ones that are providing the fresh fruits and vegetables. We also have CCLAC, which is a Community Clinic Association of LA County, and that's with Vipra. And one of the things with them is that they are the clinic association that oversees or works with 53 community clinics in the Los Angeles County, and we're one of the community clinics that works with them. And so we're the Venice Family Clinic. We're FQHC, based out of the West Los Angeles, Santa Monica area. And so we provide primary care, provide full services. But one of the programs that we had started with was providing food distribution. So when we first started to do this project last year, it was really, how do we do a food distribution event at a community clinic? And we really hadn't seen this program. We had seen this done at community-based organizations, but never related to healthcare or completely related to correlated to healthcare. That was what we first started with last year. We started our project, but of course, pandemic hit, so we were thrown into full-blown, build the plane as you fly it, and or as I like to say, be one piano lesson ahead of your student, and just make sure that you're getting this done. And that's what we were able to do. What we're now looking at, and what our project is really trying to implement a controlled way of gathering information about the impact that the work is having at a community clinic. And so that's the reason that the partnership with these 2 other organizations amongst all 3 is really taking a look at this. Not very many community clinics are providing food distribution events, and the ones that are doing it at a smaller scale, where they're doing about 100 to 150 participants. Our food distribution events average from 800 to 1,100 families that come across our food events, and we're one of the larger community health centers that's providing the food distribution. And a lot of this is possible. It's only possible because of Food Forward and what they bring to the table. And one of the things that we were really looking at is this effective? And that's where one of the things that we were looking at.
Right. So if I understand it correctly, and I was able to work with you a little bit last Friday, which was super fun, you're trying to, so this is going, you're doing it almost, you're doing it at scale, arguably at scale. And the question is, in what ways is it impactful and effective? And then how could you communicate that, and who can you communicate it with? Because I'm sure there's different audiences. Is that a fair capturing of what you got, the project from somebody who doesn't understand it very well? Vipra, do you want to chime in?
Absolutely.
Yeah.
Sure. I
The other
think
one.
you're.
There you
Oh,
go.
sorry.
That's okay.
You're right, Chris. And one of the things we started talking about were the different personas, like who is our audience? So we started talking about the health plans, that could be one audience, the patient is one audience, and then the provider or the provider clinical administrator is another audience. So we started thinking about our different personas. How are we going to communicate this impact, and who are we going to communicate this impact to? So I would agree. And it's been a interesting learning journey because we've never done this before. We're more on the clinical side. So coming to the food security piece, the social determinants of health piece has been an interesting learning
So
journey for
in
me
what
at
way has
least.
it been interesting?
Um, for me, I come from a very strong clinical background per se, so looking at more clinical indicators. So how is food insecurity or security being tracked? How do we know it's being tracked in the healthcare setting, in the healthcare space? And once they do receive that food, what happens next? How do we communicate that to our funders, to our health plans? And is it just like a one-time thing? We do want to make it sustainable. So how do other health centers start thinking about sustainability and spread? So that's been some of our thought process.
That's awesome. That's awesome. And Pearson, as part of Food Forward, um, tell us a little bit about Food Forward's perspective on the project and your shared goals.
For sure. I think anybody who's been working in the food security space has likely said at some point in time, food is medicine. And that's a common thread that happens. This is a really great opportunity for us to actually answer like any follow-up question. Well, how is food medicine? What kind of medicine is food? And being able to really make the case that access to food is a form of healthcare. It's preventative medicine. And being able to work with CCALAC and with Venice Family Clinic in order to actually put something in action instead of just doing population studies or understanding the health impacts of being food insecure. We want to see the health impacts of moving from food insecurity into a more food secure state. What sort of improvements are we going to see in people's health when their access to food improves as well?
Nice. Awesome. Yeah, it's super exciting. And just your partnership, your three-way partnership is very exciting to me. And I'm sure a great example to CCI's audience about very different organizations working together. And now you're on the cusp of being able to share, understand, and share amazing information or impact about what's going on. And that doesn't mean it's just going to, you can, we all know that it's not just that we're doing this and so it works and we're just trying to show everybody it works. You're actually trying to get insight out of it. And so additional problem solving, additional insights can come out of this information gathering and have an impact on this whole area moving forward. It's super exciting. Okay, let's get to some nitty-gritty Catalyst speak. How or in what way are some of the Catalyst methods benefiting the team or causing confusion and ultimately having some positive impact? Tell us about one of your experiences, and these can be very personal. This doesn't have to be a shared team experience. It can be like just how you're thinking about it as an individual. Who wants to share something?
Well, I think one of the issues that we were first having was trying to reset our goal and trying to figure out what is it that we want and how do we come out, what is the end goal that we want? And I think that's where we're getting stuck, in the sense that a lot of the times we were very broad and it wasn't coming down to it wasn't specific. It was a bit vague. It was a bit confusing to others. And so one of the things that we needed to work out was, we're not where we were a year ago. And so we need to kind of throw that out the window. And where are we now? And what is it that we want to get out of this? We as we said, this is a program, we really want to treat food as medicine, but is there an impact? And that was kind of the question that we kept going back to. Are we doing this to be nice, or is there an actual impact? And there is no real way to collect this type of data because there's nowhere medically that we can show the services that we're providing and the impact that we're having. We can document that someone came in and they were food insecure, but we can't document that a bag of food was provided for them.
Uh-huh. Excellent. Nice. Tanisha just commented she appreciates, Vipra, your questions. I cannot recall my health practitioner ever inquiring about how to address social determinants of health. Yeah. Nice. So how was last Friday's? Was it last Friday that no, it's the Friday before that. No, I'm losing track.
It was last Friday.
Our last work session was about clarifying your objective, right?
Correct.
Or sharing your project. How was that experience for your team?
It was really illuminating. I think, we definitely started with like Rico said, we started with a really broad topic. And honestly, this is ultimately one component of what we started with, which was how do we convince other people to do this? Or how do we create the resources needed to replicate this? But what we found during the first share out and what really prompted us to revisit that was that the people kept, they would say, I like your idea. I wish you could do this, but I wonder how you're going to prove it. And that was really helpful for us to recognize that we can't just make the case on merit alone. That if we want other FQHCs or other clinical settings to start doing food programming, we have to prove that it's effective and not just, a value add for the customer experience, that it actually has to have medical benefits. So how do we prove that? That first round really helped us, and I think to have to refine it and recognize that our problem is more specific than just how do we get everybody to do this because it's really good. Well, how do we know it's really good?
Nice. And have you been able to do either interviews or research that has started to illuminate some of these questions about data gathering, proof? How do people talk about effectiveness of food programs? Vipra?
Well,
Go ahead. No.
Go ahead, Vipra, if you want to go ahead.
Oh, no. Do you want to take that, Rigo? I was going to say, I know we've done some work already, but we had a meeting yesterday, 5 o'clock
Nice.
in the evening. We spent about 45 minutes thinking about what our questions are going to be like for our different stakeholders, but we haven't done any interviews yet.
Okay.
So I don't know, Rigo, if you want to share what you've done with the patients and the surveys.
Yeah, nice.
No, and so one of the things was that last year, again, when we had done a lot of interviews, and we were really looking at what did the patient want? What was the experience that they wanted when they were doing a food distribution, which again, that kind of went out the window because we had to follow CDC guidelines and whatnot. So what they wanted at that time was not completely feasible in the sense that there was going to be like mini health fairs that were going to provide education, physical activity, some SNAP enrollment. We were going to be able to do some more programming, and of course it was just food distribution, no contact, so that completely changed. This time around, as we were looking at the questions, we were looking at all of our stakeholders and what is it that they want and what is it that we can provide for them. And it also includes, timelines. If we're talking about the health plans, which a lot of them, right now we were fortunate where there was some that did assist with some funding. It's like great, and it was a great point that Pearson pointed out was that great. Who's funding this though from the health plan? Is it the grants giving program or is it the reimbursement program? And it's the grants giving program. They need to get rid of money and they need to do promotion, but it's not something that's sustainable or long term. And that's what we want to do. We want to be able to show that. And currently there are no ICD-10 codes or CPT codes. So that's something that we need to work with them. When we're looking at a provider, what is it that the provider wants? What is it that the provider needs? What is it that's going to be helpful for them to be able to refer patients and be able to, what is success for them? And then with the patient, what does food security mean to them? What does nutrition look to them? And that's one of the things that we are going to be asking our patients. So it was really looking at the stakeholders and really looking at what questions do we want and what is it that we can produce? What is it that we can give them?
Nice. Yeah.
And on the research side, just gonna say on the research side, it was really a lot of just, well, what do we have now? What are we starting with? The information that we do know, attendance, the number of people that come, the ratio of people who attend that are existing Venice Family Clinic patients versus, folks who are just walking up because it is open to the public. On the food forward side, we know, the amount of poundage that's coming, exactly the varieties of produce that are being offered, the frequency. We have a lot of information that is available, but it's, where is it? Is it an Excel spreadsheet that you've got to have an intern update constantly? Well, that's not really usable for making a strong case, particularly if you want to start billing a health plan for their patient population showing up. So what information do we have now to start with, and where are those gaps? Because if the most compelling piece of information isn't something that's readily available to us, we've got to figure out a way to get that.
Yeah, absolutely. Yeah, I was going to ask a number of questions just in the spirit of, talking about your project. Like, certainly Food Forward has funders, and it's interesting maybe to interview them about their reasons for doing so, right? And you probably already know that, but that's one angle. That's clearly not a reimburser for healthcare. But then, what are all the other programs that exist in California, or experiments where people are prescribing healthy vegetables to a patient? How are they doing that, and what have they set up? And hopefully finding some of those examples will inform your program, your project, as you move forward, trying to make the case. Now, you have your data that you want to collect. I understand that. And I would definitely, be designing what that is and how you're going to do it. But I would also look to create almost a mini coalition, or people that realize what you're doing, which is different than maybe what somebody who's in a clinic somewhere writing prescriptions for fresh vegetables, where it's just a one-on-one, and maybe they get to use SNAP for purchasing them at the farmer's market. Finding some of those analogous examples would be very interesting, and also support the case that this is a healthcare issue, not just a philanthropic charity handout food type issue. Right.
And that's one of the things that we've kind of been looking at, and that's kind of one of the, I guess it kind of works that, we, the Venice Family Clinic, is working with these two other entities, in the sense that, we have seen a food pharmacy program in other parts of the country. We've seen, we learned about a successful food pharmacy program in San Francisco, but San Francisco, it's a smaller area. And so a lot of their community clinics are really working with their food banks, and their food banks are the ones that are able to provide a lot of this. The fresh fruits and vegetables are non-perishable foods, and they work very well, but it's a very small area. When we start looking at somewhere like ourselves, in LA County, or something mid-California, Bakersfield area, or even Northern California area, this is not the same case. Even with us here in Southern California, there are a lot of resources, but when we try to, and this is not put by any means putting down LA Food Bank, because they do a lot of great things, when we reached out to them to assist us, their response was, you guys are the West Side, we're Santa Monica, we're Pacific Palisades, we're Malibu, we're Marina Del Rey. And that's what you think of when you think of the West LA area. You don't think of the in-between pockets of people, and we've been here for 50 years because there are those that have food insecurity, that do need primary care, and when we're trying to restate that, they're like, our areas, we already know where the focus areas are at, and there is a food bank in your area. And when we reached out, they were not able to assist us at the level that Food Forward is assisting us, and therefore us being able to assist our patients and the community.
Right. Yeah. As I listen to you talk, again, more about the project, I'm in doing this work, I'm always looking for very interesting stories within what you're saying, or insights that can be brought into your project as you go. Like, you should be saving some of these things, like, here's where all the attention goes, but in these pockets, we're in a pocket, and we still have huge needs, but we're a neglected pocket. And so I just think it's interesting to hear how you're talking about your project and not lose some of those insights that are unique conditions or turns of phrases that are quite powerful in terms of characterizing what your project is about, and or telling the story eventually. Now, I don't want to get ahead of us because telling your story is going to come down the line in stage 5 where you're much farther along. But that's very helpful. I'm going to go to some of the questions and comments we have in the folks watching. Sarah said, we just worked with our EHR hosting service to create a form that was tied to observation terms to track some of these services being provided. So if I understand that correctly, it sounds like you're adjusting the EHR to capture some of the information for service non-standard services or non-reimbursable services, so at least you're starting to track them.
Right.
So connecting with Sarah might be interesting. You guys might be already doing that. Tanisha says, from what lens or denominator determines the viability of addressing food insecurity? From what lens or denominator determines the viability? So if I read into this question, I think what Tanisha is asking is, why wouldn't it be justified to provide food for those in need? Why wouldn't, right? And so in some ways, this is the equity, an issue of equity and access to food and certainly need. And I think that's where this is an interesting cross between what gets reimbursed by health systems and the true needs of a community. And maybe, I'm just continuing to think out loud, maybe, this notion that it's clearly an issue of equity, but if healthcare plans or reimbursers, payers aren't doing that, it is an issue of inequity. And maybe that lever of argument could be along with the data, along with the quote proof, if I'm not reading too much into Tanisha's question.
Well, if I could add, I think, we've, like I said at the top, this food access as medicine is, it's not to say that it's not fundable through, non-medical, non-health plan funds, because it certainly is. We're a nonprofit. That's, that's the only thing we do. That's our, pardon the pun, it's our bread and butter is food. But the idea that we could actually make, that funding come out of the health plans in a way that is very specifically tied to health outcomes, it makes the case a lot stronger. And it also reserves some of that corporate social responsibility dollars for other programming that maybe isn't focused on, KPIs or ROIs. If you can make the case to a health plan that they should be paying you for providing food to their customers, that allows you to scale without having to go out and do grant funding specific to your programming or, with specific reporting requirements that go beyond the scope of what you're capable to do. There is ample funding, particularly now, around food security, because I think the story of food insecurity is more tangible since the pandemic. But any opportunity to make a stronger case to funders, especially if you can just bill them, that allows you to scale.
Right. Yeah. And I think one of the biggest things is, as we're looking at this, even from a community health center's point of view, is that, we funders, such as LA Care, health insurance plans or IPAs, they hold the money bags, and I think that they're able to make changes with it. I mean, several years ago, if anyone who was in the community health center, how many times did we have to report on patients who were not on lipid lowering medication? And anybody had to be on lipid lowering medication, and it was even pushing the providers to go against what they may believe, but put them on this medication. Why are we not doing the same thing with food? And we talk about change your eating habits. Well, what does that mean? If a cheeseburger is 99 cents and it's easier for me to buy for my family, even though I know it's bad, I'm going to go that route as opposed to buying fresh fruits and vegetables, which might be much more expensive, better for my health, but are only going to feed half of my family.
Yep. Yeah. The calorie density of cheap fast food for the price is hard to argue against. So this is why it's also a movement of, like you, Rigo, you do this, health education and or community building. I think CCI just had a, was it a webinar or maybe a podcast episode that came out with the founder of Every Table? Every Table is bringing healthy food into marginalized communities, but also the purveyor or the person who's running one of the Every Table front stores that has grab and go healthy food for price neighborhood appropriate prices. So it's like $5 for it's still expensive, I guess, in the big picture of, you know, a single meal, but it's really high quality proteins, grains, et cetera. But that person would also run other ones, hence building economic empowerment. Not to get off subject, but all these issues, these are wicked problems, right? And so they're complex. So you have, how do we get people to want, how do we get the community to almost participate in the movement of wanting healthy food for their community and the benefits it brings the community when you do that. So that's one thing I'm thinking about. I just saw a couple more comments come in. Sophie says, KLAIM brings new incentive payments in lieu of services, including meals. Health plans are not required to do this, but can get new incentives for partnerships. So just a possible, you guys might recognize those acronyms that I don't. And Sophie, your lips are moving and I don't know what you're saying, but you guys do. Thank you for that. Awesome. This is expected to start in January 22.
Right.
Got it. Okay. You guys are all aware of that. Okay, maybe one last question before we close up. The time goes really quick. It's already 12:38. Any really key challenge on your team's having? Like, you can't stand working with each other, Rigo dominates every conversation, Vipra's microphone is relentlessly quiet. What are the challenges the team's having? Pearson's too positive all the time. And it obviously not interpersonal necessarily,
Right.
but doing the Catalyst work on this project. Who wants to share? Yeah, go ahead.
Go
Vipra.
first with my rickety microphone. So I think for me, it's other competing priorities with COVID and with vaccination ramping up, at least at the consortium level. It's been really challenging to dedicate some time specifically for this. So having those weekly huddles, or even just, you know, spending that 20 minutes, just thinking about this project has been helpful, but it has been challenging at the same time, just to find some dedicated time.
Yeah, and that, I really appreciate that, because there's just like kind of a constant worry in the back of everybody's mind, like, when are we going to get together? How can we get together? Oh, I'm getting called away. Like, I hope that does not present too much stress within the Catalyst context. And we understand how hard it is to make this progress week by week. So appreciate you sharing that, and definitely we're all in this struggle together to try to find ways to make the work a little bit more seamless, either by supporting you through virtual events or just bringing the expectations, but how can we make this helpful for your actual project? Like, if you're able to achieve the goal of the project, like, that's a huge win, right? That's a huge win. So maybe even, we haven't talked about this within the context of the Catalyst program, but the degree to which we can say no or push back to some other things in the organization by articulating the importance of the work you're doing in this project, right? It's a risk-taking thing, or it's a like, oh, there's no way, I just have to say yes to everything people ask me of. But sometimes making progress on a really important project like this that could be innovative and have big repercussions can come from saying, no, I need the 20% per week or whatever, 10% per week, because, and then being able to articulate that value. And as your project gets clearer and the potential impact becomes clearer, you can make that case and start gathering more time for the project. And that's just, I mean, that's not just for you guys, that's just a general kind of comment for the Catalyst community overall. Kathleen has a question. How has the partnership changed now that this program is virtual?
I think with both Pearson and I having gone through the first session last year in person, one of the things that I think does make it a bit difficult is kind of what Vipra said, is that there are competing factors, there are competing events. You know, we're a community clinic, our health ed department, you know, we're a non-reimbursable department, so we want to make sure that we stay active within the clinic, so that, you know, not that there's any cuts or anything coming, but we don't want to be put in that spotlight where we're costing the company money. So sometimes we're pulled to assist with the COVID vaccine or COVID testing, for example. But one of the things that I think that has made it a little difficult is that when we were away, you are able to kind of just sit and focus on this and easily kind of push everything away. You know, you don't have your phones, you don't have anybody coming in, you don't have a phone ringing while this is happening. It's complete focus. I think that's what's made it a little difficult throughout, you know. But in regards with our partnership, we continue to work where we've been working together. So the base is there that we're working very well with one another.
Yeah,
Nice.
and in a lot of ways, you know, some of the coordination and collaboration actually got easier as more workplaces adapted to, you know, virtual work. Whereas like last year when, you know, the projects first started, we were thinking, when are we going to find time to, like, who's going to drive? Like, I got to drive to the west side. Like, I don't even live anywhere near there, because nobody was really thinking about this, you know, Zoom. I didn't have Zoom downloaded. And so some of the collaborative work is actually easier because we're, you know, we work at different organizations. So while the calendar sync is still difficult, you're not factoring in, you know, 2 hours of traffic like you used to have to.
Yeah, 100%. And so in LA, 2 hours of traffic is like going 4 blocks, right?
Yeah,
Correct.
you could probably walk faster.
No, sorry, I didn't mean to throw shade at LA. I love LA. Just
It's hot. We could use some of that shade, actually. It's really hot right now.
Yeah.
I was telling Vino this morning, it's 26 degrees in Chicago today. Pearson's like, ooh, not that much shade. All right. Thank you so much, you guys, for spending time with us today. Tons of comments on thanking you guys for what you're doing, sharing your work, embodying that behavior of sharing work early and often, transparency, collaboration. Please don't hesitate to reach out if you guys need anything. And I guess we'll see you today's Thursday, so next Tuesday.